Have police, lawyers, the CBC, and public health agents colluded to quell an important investigation into the COVID-19 vaccine status of mothers whose babies died suddenly? Let's dig in. Mary Ugolini here with Rebel News, and in today's report, I am going to show you how at least one Canadian public health agent and their family member worked in conjunction with police and media to weaponize an internal police investigation into the COVID-19 vaccine status of mothers whose babies had died suddenly. It all began in February of 2022, when it is said that Ottawa Police Services detective, who is a constable by rank, Helen Grus, was suspended without pay for failing to disclose her COVID-19 vaccination status to the medical tyrant higher-ups. The next day, Grus was suspended with pay for apparently breaching police database privacy, where she attempted to probe for information regarding the COVID-19 vaccine status of mothers following a string of 9 infant and child death cases in the region from June 2020 to January of 2022. Yet Grus was part of the child sexual assault and abuse squad at the OPS, which is mandated by law to investigate all instances of sudden and unexplained death in newborns, infants, and children under the age of 5. It is said that officers in this unit undergo intense training and develop incredible skills and empathy to be able to relate to victims or accusers in a way that ordinary, uniformed officers cannot. For upholding the role of her unit, Grus was removed from her position through what appears to be still unproven allegations without adequate disclosure. And CBC reporter Shamini Yogertaman appears to have insider knowledge of the investigation. In her article from March 28, 2022, she says that Grus is alleged to have accessed files that she was not assigned and then contacted the coroner's office to learn the COVID-19 vaccination status of parents in the cases. Aside from the insider information appearing to be obtained by the CBC, which we will get into more a bit later on, there was another strange turn in this case. As first reported by the Western Standard, the Public Health Agency of Canada has also been closely following Grus's trial. Dr. Margaret de Grus, scientific manager of the analysis section of the Public Health Agency of Canada, watched the entire September 15th online hearing. They received that information from former Toronto Police Detective Donald Best, who has been following the case closely, albeit very publicly, unlike this senior public health official who prefers to lurk in the background. And let's not forget that the Public Health Agency of Canada is heavily involved in the shaping of government COVID-19 policies, and a senior level official like de Grus would have likely worked with and relate to personnel who are part of the COVID-19 advisory team. Margaret de Grus has worked on published papers, including those on COVID-19, mostly as it relates to mental health, substance abuse, and adherence to public health restrictions in relation to the pandemic. In speaking exclusively with Rebel News, Donald Best asserts that he contacted de Grus to ask why she attended the hearing and was promptly contacted by her biological daughter thereafter, who threatened him with a lawsuit if he disclosed de Grus's attendance publicly. The daughter is Sarah Del Villano, who, according to her Twitter, is a legal articling student by day and a harm reduction advocate by night. As it turns out, Del Villano has co-authored at least one government policy-related paper with her mother on providing opiate addicts with a supervised injection service. Del Villano regularly responds to Donald Best on Twitter when he posts updates on the Grus case, slinging slurs like calling him insane and telling him that updating the public is causing harm to Grus's supposed victims, which apparently is Del Villano's own baby. According to this GoFundMe page, her baby tragically passed away shortly after her first birthday. Now, I want to say that my heart truly goes out to this grieving mother. No one should ever have to live through the loss of a child. It is truly a devastating and horrific tragedy, and I do not want to downplay that tragedy in this report. But the connections with this investigation and the Public Health Agency of Canada, the collaboration with the CBC and lawyers appearing to act out of their own self-interest instead of ethically, are of great public concern. You see, Del Villano also works for the law firm Durand Barristers. And remember that CBC reporter, Shamini Yogertaman, with insider information? Well, she did a feature report with a lawyer representing a grieving mother, and the lawyer was Aaron Durand. That's right. Aaron Durant, the founder of Durant Barristers, the law firm where the public health agent Margaret DeGroo's daughter, Sarah Del Villano, works. Would you call this a massive conflict of interest? And then for the CBC reporter and her insider information, well, in the initial report that she did on Grus, she refers extensively to quote-unquote sources, which of course she does not name. One paragraph specifically says, sources also described Grus as holding anti-mask and anti-vaccine views in the workplace. Does this sound like perhaps the source may be someone then from the workplace? And if so, this is a massive collusion between a public health agent, the internal investigations of the police, and the mainstream media to prosecute and persecute an esteemed detective in a good faith investigation for not only political, but also public health reasons. This is meddling and an actual conspiracy, not just a debunkable theory. And yet it is being alleged that Grus has since been ordered back to work. So what changed and what are her current duties? If this was such a breach of privacy and discreditable conduct, why would she not only be allowed, but ordered back to work? And were there other detectives, or was the coroner involved in these cases asking the same questions as Grus? Could the COVID-19 vaccine status of those mothers whose babies died suddenly be an important investigatory detail? We know now from the JAMA study, residual mRNA has been found in the expressed breast milk of nursing mothers, and as pointed out by viral immunologist Dr. Byram Bridle, oral administration of this novel product has never been studied, authorized, or otherwise approved. So how it acts once consumed is entirely unknown, let alone the extra vulnerable nature of a rapidly developing infant's body. And as per the package insert of these novel injections, the safety and efficacy was never established in pregnant women or breastfeeding women. As of April 14th, 2023, there were at least 673 cases where COVID-19 vaccine exposure via breast milk was cited for adverse events in the CDC's Vaccine Adverse Events Reporting System, otherwise known as VAERS. Have the Ottawa Police, mainstream media, and at least one public health agent colluded to quell an important investigation of great public interest that could have led to tangible evidence of harm, potentially saving other mothers and babies from a similar fate? Stay tuned here at Rebel News as more details are released at Grus's in-person hearing this Friday, April 28th, beginning at 9:30 a.m., where we will likely hear why and when Grus was ordered back to work, and if the disclosure items that her lawyer requested back in December of 2022 were ever released. For Rebel News, I'm Tamara Ugolini. This kind of coordinated and orchestrated effort to quiet and censor anyone who dared question the safe and effective narrative is exactly why we launched a petition campaign at stopmedicalsilencing.com. If you think professionals using their knowledge and expertise to formulate their own opinions is a cornerstone of scientific discovery, then head on over to our website at stopmedicalsilencing.com and sign our petition.